At the Betty Irene Moore Children's Heart Center, we are known nationally and internationally for taking on some of the most complex patients.
That relates a lot to the fact that we are on the Stanford campus, and we are an academic children's hospital, which means that we're always looking for new ways to approach problems. We're aiming to develop new treatments. We're doing research with our patients and their families to improve what we do. And part of that always involves the willingness to take on the most difficult cases. And together, I think we work really as a seamless team of individuals with specialty expertise that we can bring to bear for any problem related to pediatric cardiovascular disease.
We perform the entire spectrum of conditions, fetal, neonatal, all the way up to adults. We take care of that entire spectrum. We're not reluctant to take on the most complex patients.
Our program in the Moore Children's Heart Center at Packard Children's Hospital is a high-volume program, meaning that we operate on and treat hundreds of children a year. Typically, we're performing operations on 600 to 700 children a year with structural heart defects. If we look at all the children and the young adults who come to us for these procedures, the overall survival rate here is over 97.5%. So that's all types of heart disease, from the simpler types to the most complex types. That's an excellent outcome.
What is most rewarding to us, maybe even more rewarding than seeing a healthy child leave the hospital who came in with a hopeless condition, is receiving a holiday card or a first grade graduation card or even a high school graduation card from a family with a picture of a healthy looking individual. I think it is that commitment to a patient-centered type care, transparency, respect for the patient, always recognizing that we're not just doing a procedure, we're working with a family. These are core elements of our program, and I think this is what is extremely important to families.